It is 7 o'clock, so we would like to
Awesome.
get started by welcoming everybody to Wednesday Wellness. Wednesday Wellness is a free live educational series by Trinity Health. We're thrilled that you guys have decided to join us here for this important discussion on support groups and survivorship services. But before we get started, we do want to make a few housekeeping notes. Cameras and microphones have been turned off to ensure a smooth experience for everyone. If there are questions throughout the presentation, there is a Q&A chat feature located in the toolbar at the bottom of the screen. Any questions that we are not addressed during the presentation, we will work on at the end of the session. Lastly, today's webinar is being recorded and a link to the video will be shared with you via email over the next few days. And without further ado, it's my pleasure to introduce you to Jen Levine, who is a cancer survivorship nurse practitioner with Trinity Health Medical Group and the Lax Cancer Center.
Hello. Um, so I'm sure we'll see more people coming in, but um, this will probably take a lot longer. I know some of the talks have been shorter, but so I'm Jen. I have worked in oncology for almost 18 years. Um, a lot of that was spent on the inpatient unit, and I've been a nurse practitioner for 7 years. So I was at a different practice and then helped open up the Trinity Health Grand Rapids. So, okay, hold on. Apparently, I was not moving enough. Okay, sorry about that. So I'm going to go through a few things, but I really want to kind of go because survivorship always seems like a really scary topic. Um, and I had to put all my credentials. So that alphabet soup at the end of my name is just saying that I have a master's. I'm in adult gerontology, primary care. I have a certification for bone density and also in oncology. So I have been doing this for a hot minute, and survivorship is really my baby. It's something that I have done for the past 7 years, and it's really near and dear to my heart. So, survivorship, I the term is not my favorite, but it was something came up that cancer groups came up with, 30, 40 years ago. And now I'm stuck with it. But a lot of people don't have a good understanding of what survivorship is. So, NCCN, which is the National Comprehensive Cancer Network, is kind of our oncology Bible, if you will. And they say that any person that is diagnosed with cancer throughout the balance of life is considered a cancer survivor. So even if you're actively getting treatment, if we've hit the 5 years and you are deemed cancer free, if you know me, you know that I do not love the word cancer free. I think it's a misnomer because we never know, right? So anyway, this is just what NCCN says. Um, so it's people that are living with cancer, or they've completed treatment and are living life after cancer. Also, anybody with a history of cancer. So, in my practice, I tend to focus on curative intent patients. So, not saying that I can't treat those patients that are metastatic, where cancer has gone other places in the body. But generally speaking, I do, there's only one of me in the practice. And so I generally tend to focus on the patients who will have whatever cancer therapy be done. And then, we're looking at surveillance. But there is a place for long-term cancers. So there's a lot of cancers like multiple myeloma, a lot of the chronic leukemias, things like that, that patients can live for a really, really long time. Um, there's a place for survivorship in that. And then we know that there's a lot of patients that are living with metastatic cancer, and we've come a long way with treatment so that those patients are living a long time with their cancers. So their cancer may never go away, but they're still living life. So, and really, I focus on patients who are really done with all of their treatment. Um, my main population is breast cancer patients when they're in surveillance. So they're done with surgery, radiation, chemo if they needed it. They're on anti-hormonal therapy or not, and we're just looking at surveillance. All right, so our lovely NCCN gives us these standards that we go through, and you know, a lot of these should be covered throughout treatment. Um, but a lot of times people are either you know, overwhelmed by their diagnosis, or, you know, these are things that need to be, re, talked about more and more. So I always like to tell people, this should be kind of going through, we should be covering some of this throughout your cancer journey, but oftentimes that's these aren't the things that we're really concerned about. So we are looking at surveillance and screening. So that's not just the cancer that you may have, that's also other cancers. So, for my breast cancer patients, I remind them to make sure that they're getting their colonoscopies and skin cancer screenings if need be. We're looking for late effects of treatment, coordinating of care between primary care, other specialties. We know that cancer patients don't just have cancer usually. And so we're trying to help manage, and it takes a village to make sure all of you get the good care that you have. I'll talk about a little bit of the healthy behaviors. And a lot of what people don't realize is that, when you're going through cancer treatment, a lot of these side effects can last a really, really long time. I always say that anytime you get radiation, the fatigue from radiation can last 6 to 12 months. And that's not something that people really understand when they're first getting radiation. And then their ongoing surveillance for their own cancer. So, what scans are needed, what scans aren't needed, what labs may or may not be needed. So that's something I kind of help patients understand. So for healthy lifestyles, we obviously want to try and improve your quality of life, and diet and activity can also help reduce the risk of cancer recurrence. We'll go into that a little bit more. All right, so physical activity. My biggest thing that I tell patients is don't be a lump on a log. You want to make sure that you're getting in activity. And that doesn't mean, going to a crazy gym or running a marathon. It is trying to get in um, a minimum of 150 minutes a week. So that's 30 minutes 5 times a week. And what I tell people is we should really be focusing on getting that heart rate up. I'll talk about strength and everything else. But so if you're going for a walk, one way to judge whether you're getting your heart rate up high enough is you should be able to speak in sentences and not paragraphs. Some people say you shouldn't be able to sing. Nobody wants me to sing while I'm working out. So, but getting your heart rate up enough. And it doesn't have to be like 0 to 150, pun intended. We're looking at like small baby steps. So we're looking at like, okay, if we haven't been super active, let's start with 5 to 10 minutes a couple times a week, and then we can kind of work that up. Our friends in physical therapy are really great. And Mary Freebed actually has a cancer rehab program, and I think Advent does too, where they really work on balance and strength and endurance, just to kind of make sure that we are continuing to move. Now, the other thing that's really important is to get in some strength. And this isn't like going to the gym and lifting heavy. This is more using small weights, body weight exercises. All of my patients hate it because I say squats and lunges are actually really good, but then we have to deal with the knees and the hips and things like that. But even using resistance bands, if people are out there and don't have a ton of money to go to a gym or anything, find stuff at home. Soup cans, they weigh 1 pound each. Um, Lifting laundry baskets, that counts. Maybe not once. If we're doing multiple reps, that would be good. And then we want to try and work on stretching just to make sure that our muscles are good. And then as we get older, patients who have chemotherapy and have issues with neuropathy from, in their fingers, their toes. Sometimes their balance might not be there. I do train stress fall prevention. So I always remember my grandma's house and even my parents. They always had throw rugs, and I'm like, bro, that is like a huge tripping hazard. But they love their throw rugs. So working with people to like understand how to fit fall prevention in. All right, so nutrition. Um, there is no anti-cancer diet. And if you've ever met with one of our dietitians, that is kind of one thing. Um, and I think people get confused when I talk about plant-based, and I think I forgot to change this slide, but I usually tell people a plant forward diet. So if we're looking at the diagram of myplate.gov, half of your plate should be fruits and veggies. And we always say eat the rainbow, because the more colors you have in your diet, the more nutrients you're getting. Um, so I like to say plant forward, because I think people confuse plant based with, becoming vegan, vegetarian, things like that. No, it's absolutely fine to keep eating your meats, and we prefer lean meats. There is still some correlation with red meat and colon cancer. But to be honest, I have a quarter of a cow sitting in my freezer right now. So um, everything in moderation. Alcohol, refined sugar, those are also things that can have links to cancer. However, again, everything in moderation. And with the sugar, everybody kind of freaks out because there's that misnomer of, oh, cancer feeds off sugar. And our dietitian is actually really good, because she's like, well, actually, all of your cells need sugar. Um, Cancer cells are just greedier. So it's a matter of um, in moderation. So have a cupcake, maybe not a whole cake. Um, have a glass of wine, maybe not a whole bottle of wine. So just being able to figure that out. But just know that there's no anti-cancer diets. All right, supplements. This is one of my least favorite things right now. So biggest thing is supplements have not been shown to control, prevent, or stop cancer. There Unless you have a documented deficiency, and a lot of my breast cancer patients will tell you that I love talking about vitamin D, because we live in Michigan and we spend 6 months of the year not seeing the sun, and the sun is our biggest producer of vitamin D, and there's very few foods out there that have vitamin D. So if you have a documented deficiency, and when you're getting cancer treatment, a lot of times we were drawing labs. So we're noticing if there's any electrolytes that are off. Um, Otherwise, if you have an inadequate diet, malabsorption issues. So a lot of times I'll see that in patients who maybe had a history of bariatric surgery or something. And then other comorbidities or other health conditions that you might have, that also plays a role. But I don't know if I put this on here, but don't take a supplement for something that you can eat, because your body's going to absorb those um, that natural vitamins and minerals better than any supplement will. And if you're taking too much of a supplement, all you do is make really expensive urine that can't be used for anything. So don't take a supplement that you can eat. And then, listen to your healthcare providers as far as if there are any deficiencies that you would need to take. Also can save you a bunch of money. Immunizations, we still recommend the vaccine schedule. Generally speaking, some of the shorter term vaccines, so the influenza and COVID vaccines, we recommend anytime. And then any other vaccines, we recommend 2 to 4 weeks prior to starting treatment or 3 months after starting cancer treatment. And that's to make sure that your body can mount that immune response. And then there are certain medications out there that are monoclonal antibodies that target B cells. And for those patients, we'll make sure we let you know that we would delay any immunizations other than the flu and COVID 6 months after cancer treatment. Oh, go back. Okay, so we're going to talk about long-term late effects. So cognitive dysfunction. So a lot of you may know this as chemo brain fog. A lot of times people will tell me they have trouble multitasking. They can't concentrate for as long. That short-term memory. And a lot of people get concerned that it may be, early set on Alzheimer's or dementia, and it's not. And there can be a lot of causes. So cancer itself, especially if you have um, any involvement in the brain or nervous system, treatment, anxiety, depression, fatigue, all of that can play a role in your ability to function. Biggest thing is and we've gotten better about this over the years, but making sure you guys know that this is a real thing. We kind of poo-pooed it for a lot of years, but we're realizing that it is a big problem and a very long-lasting problem. So we obviously need to make sure that there's no issues with cancer coming back. Other disease processes and other medications can also affect this as well. There is cognitive rehabilitation. So a lot of the physical therapy places, it's almost like a concussion protocol, or where they're kind of helping you with being able to function, and help kind of change the way you think. I always tell people that you're going to need more reminders. You're going to need more. I'm so sorry. You're going to need more sticky notes, alarms, things like that. There are medications, but they are all off label. So I have tried to prescribe these to patients, and insurance has told me a big old nope. So know that these are out there. We're just not prescribing them on a regular basis because there's nowhere in guidelines that recommends these. So cardiovascular, we know that there's a lot of risk factors that can cause this. most of the time you'll hear about this from your primary care, but we also know that a lot of the treatments we give can also impact um, your heart health. So some complications that can happen are heart failure, high blood pressure, arrhythmias. So we really are, um, when we send you to go get a EKG or we send you to go get an echocardiogram, it's not because we're trying to be mean. We're trying to catch those things early. And we don't have it, but our friends up the hill have a couple cardio oncologists who specifically see patients who are higher risk, that are getting treatment. So, and one thing that I kind of take is, make sure you're following with your primary care as well, because they're going to help us manage the high blood pressure, the cholesterol, any of those other medical conditions that might be um, part of your heart health. Mental health. So we know that any cancer can cause anxiety, depression. I usually tell patients who have had chemotherapy that there is a PTSD component to this. And a lot of it, especially once you're done with treatment, there's that fear of reoccurrence. I had a patient today who was finishing chemo and we are really excited. And she's like, yeah, but I don't know what my life is going to look like after this because this has become so much of my identity. And so, really making sure that we address the whole person. And that's also looking at like other things that can cause it. Is it stresses at home? Is it pain? Is it because you're so tired? And then knowing that there's resources out there. So, here at Trinity, we have our spiritual care. We have a great group of social workers. Um, we just hired at Trinity Grand Rapids. Well, she came with her husband, but Kelly Holder, she's a psychologist. So she's going to be doing a lot of, I think she may have done a talk already, but she's doing kind of psychosocial assessments and treatment for our cancer patients. And then obviously we do have the medications out there, whether it's antidepressants um, or anti-anxiety medications. Okay, so fatigue. This is the best definition out there, and it comes from the NCCN. But it's just that persistent and physical, emotional, cognitive tiredness. And I tell people, I'm like, it's hard to describe, but like it when you feel it. So if you've had chemotherapy or you've had radiation therapy, you understand that it's just like it's not just tired, your whole body is just exhausted. So and it can really impact functioning in daily life. So almost generally speaking, I say almost everybody who has cancer treatment can have fatigue. It can be long lasting. Like I said, people who get radiation therapy, oftentimes that fatigue lasts for 6 to 12 months, sometimes longer. So biggest thing is we want to make sure there's nothing else going on. So we're gonna, sometimes we'll check your heart, we'll check to make sure your blood counts are okay. Sometimes your thyroid can cause fatigue. And a lot of people don't understand, but remember when I talked about exercise? That is literally the best way to help combat fatigue. Um, and I know it sounds counterintuitive because you're like, yeah, but my body's tired. But the more you stay active, the better your body does. And then that's where I also talk about it doesn't have to be 0 to 100. If we are looking at, hey, we're doing, 5 minutes of walking. Again, kind of hard in the winter. But even if you're walking around your house or doing any chair exercises is great. I always talk about the 90s sit and fit lady on PBS that she had all the spandex on and but she got people moving in the chair. So there's a lot of things out there that you can do to help that manage that. Also, making sure that you're um, getting good sleep hygiene. We'll talk about that in a minute. And sometimes, very rarely, we can use stimulants similar to, I think we've had a couple um, people be on like a Ritalin or Adderall at a very low dose just to help out. But usually we don't resort to that unless it's a pretty significant issue. Lymphedema. So the lymphedema can happen pretty much any time lymph nodes are messed with. So the best way to think about this is when you have lymph nodes taken out, it creates a roadblock for that lymph fluid to go through. There's some lymph fluid that figures it out, they go around it, and some that just get stuck and they don't really know where to go. So we have done a better job because of managing this, not only because in surgery they're taking out less lymph nodes, but we're also catching it sooner. So, if you think about any breast cancer patient from the 70s, 80s, everybody got a mastectomy, everybody had a whole bunch of lymph nodes, and their arm starts looking like the third or fourth, and it's hard to manage at that point. Now we're catching it more at the stage 1, stage 2, and we've got a lot more resources available as far as lymphedema clinic um, and things like that. So, and I put usually occurs within 3 years, but I have also had patients come back 5 years later and have issues with lymphedema. So, generally seen in our breast cancer patients, but I don't exclude anybody. I've had a couple patients who have had abdominal surgeries, pelvic surgeries, and they wound up with lower extremity edema. But the earlier we can catch it, the better we can treat it. All right, so we talk about pain. There's a lot of pain syndromes out there. You can have acute pain, you can have chronic pain. A lot of times we've got great resources to help with cancer related pain. But we also need to understand that some of these pains can last a lot longer than just during treatment. So I always think about our neuropathy patients who, once that comes on, and if we didn't catch it early enough, we may have a permanent problem. But they're also coming out with a lot of cool stuff as far as pain stimulators or nerve blocks, things like that. So just know that there's not a one-way path to pain, and a lot of times I wind up doing drive-by consults with our palliative care team to see what's best for patients. So here's some management strategies, and I always remind people that they can use your heat, ice. Some people find acupuncture really helpful, especially with a neuropathy. I have heard that it doesn't last very long, but it has been effective. And then obviously using your medication toolbox. So using over-the-counter meds. I think people sometimes forget about that bit, but they do work for a lot of people. And then, again, our physical therapy, occupational therapy friends, they tend to help us out a bunch too. So, All right, I told you we'd come back to sleep. So biggest thing is devices and blue lights are kind of our detriment in sleep. And then we add in chemotherapy and maybe not feeling well and napping during the day, and we kind of screw up all of our sleep schedules. So these are things that are recommended. So consistent sleep schedule. Try not to exercise crazy before bed. Um, Try and get rid of that blue light before bed. So usually people studies have said about 1 to 2 hours before. Don't be on your phone. Don't watch TV. Realistically, I think that's going to be hard, but because that's the world we live in. Um, Eating, drinking, smoking right before bed. It says no caffeine 4 hours prior to bedtime. But I work with a nurse practitioner who can literally drink coffee all day and still fall asleep by 9 p.m. So good for her. I would not do well. Try and limit naps during the day because that can throw off the sleep schedule. I tell people keep a sleep log. Like what time did you fall asleep? What were you doing? What helped you fall asleep? And then, some people might need to be referred for a sleep study. Um, and then there are a ton of relaxation techniques, deep breathing exercises, meditations that are on YouTube. And then, medications have their role. I will say I stay away from all the Ambiens, um, but we do have medications out there. All right, so a lot of times I put this in here for my prostate cancer patients and mainly my breast cancer patients, but I know any ovarian, cervical cancer, uterine cancer can all have this problem. And I deal with a lot of it, especially with our breast cancer patients being on anti-hormonal therapy. So just, our body is made hormones. And then, for women, once we start hitting perimenopause, we start losing that. So that's where we get a lot of the hot flashes, the vaginal dryness, the brain fog. There's sexual dysfunction. And this can also happen with our prostate cancer patients, testicular cancer patients. Just going through chemotherapy can sometimes have these as well. And it's just a matter of helping manage those because a lot of times we can't give hormone replacement like we would. And I know there's a lot of things coming out with hormone replacement therapy, especially in the women's world. Um, but we haven't come to a consensus as far as oncology groups to see what we're gonna do. But these are things that people can experience and we help manage. All right, so now I get to go into all the fun stuff. So I always say I can't live without my team. So think about everybody who is helping to manage your cancer care. So you've got your medical oncologist who deals with the chemotherapy and the surgical oncologist and radiation, and then social work and dietitian, and you got all of these people, and all of us work together in tandem to make sure that your needs are being met. So even if you aren't seeing these people, it doesn't mean that we're not communicating with them. So, and then, bringing in primary care. So one of the things that I like to do in my notes that get sent to primary care is let them know that what we would like them to be responsible for. So I promise all of my patients they do not want me managing high blood pressure or diabetes or high cholesterol. I haven't done that since I was in grad school, and I'm pretty sure things have changed in the past 7 years. So, but just know that we have all of these resources. We're all working as a team, and it's really something that all of these people have some little bit to your cancer care. All right, so social support groups. Um, Social media, I always say beware. I think they have a place, but I also find that people who are on social media support groups tend to talk about the worst of the worst. And they're not the ones out there living life and working and being active. They're kind of sometimes they tend to be a Debbie Downer. Again, I think they have their place, and I think they're good resources. Um, but I also just caution people to make sure that you're not going down the road of doom and gloom. So I actually have a patient resource guide that one of our social workers gave us, which I can provide, that gives local support groups and national resources and financial, and there's a lot of other stuff. Good Lord, this timer is all right. I'm going in the dark. Um, but my favorite is Gilda's Club. They are in Grand Rapids and Lowell, and they have a ton of activities that are for cancer survivors, for kids, for caregivers, and I like it because they also have moderators who help with all of that, all of the support groups, so that we're not going down those rabbit holes, those dark things. The Live Strong program at the YMCA, if you've never heard of that, please know that that's available. Kind of get you back into exercise. They have a lot um, of good things. It's a 12-week program. They have dietitians come in. They do various workouts, and they base it on your ability. So you're not going to go crazy. Bluebird retreats. They have retreats available for patients, caregivers, couples, and I've heard a lot of great things. And then Beautiful You is out there. They help with a lot of mastectomy bras, prosthetics, wigs, and they just have a whole bunch of other resources available. And then there's always the national resources. So I love sending people to American Cancer Society. They have a ton of resources. And then there's some other ones out there. Immerman Angels is um, a mentorship group. So they take people who have gone through cancer, and they partner them with somebody newly diagnosed. Super great resource. And they are always looking for people to be mentors. So if you've gone through cancer treatment and you want to help mentor somebody that's in a similar situation, um, that's always available. And then obviously we've got a ton of mental health services, and there's transportation. So there's a lot of great resources out there. And if there's anything that you have questions, ask your care team, because we can likely find some resource for you. Any questions?
Jen, I think we're looking good on questions right now.
Cool.
Thank you so much.
Yeah. So Brittany, I can send you this PowerPoint as well as the patient resource guide if you think that would be helpful.
That would be extremely, extremely helpful, Jen.
You
And
got it.
that was an excellent presentation. It was
Thanks.
very informative. So I think you probably covered everybody's questions that they may have had come up. But if we receive any over email, would it be
Mhm.
okay if oh, actually, people are
Oh,
popping in a couple questions. So
here we
let's see
go.
if we can. It says,
Awesome.
how do you get an appointment with a dietitian?
All you have to do is ask. So, all of our um all of our places have dietitians. Um, all you have to do is ask a nurse, ask any of your providers, and we can get you in.
Thank you so much, Jen. And as a
Mhm.
reminder, if anybody has any additional questions, you're welcome to use the Q&A feature. Oh, and we got a couple more. Are there
Beautiful.
support groups in, is it Washtenaw County?
That's a great question, Karen. I am not sure. My recommendation would be to reach out to your cancer center, because oftentimes they will be able to provide resources that are available out there. Um, I don't, you can also just Google and see what's available. If there's not anything local, that's kind of where I tend to tell people to gravitate toward, like the American Cancer Society. They've got a ton of resources out there.
Perfect. Thank you so much. So yes, as I mentioned, the Q&A feature is at the bottom. We can hold it open for just a second. But Jen, the question I was going to ask you is if people have questions over the next couple of days and they
Mhm.
send those in to us via email, is it okay if we get those over to you to follow up?
Yeah, absolutely.
Okay, well, wonderful.
I will say sometimes it takes me a hot minute to go through my email because there's a lot of IT emails that I have to get rid of. But yeah, happy
Okay,
to answer those if they come through.
well, wonderful. Well, as I mentioned, that was an extremely informative presentation. So I think you've likely answered most of the questions that people had. It was wonderful. And
Perfect.
as I mentioned at the beginning, we will share this information via a recording over the next few days. We'll also provide some of those resources like that guide that Jen mentioned. So
Yeah.
we'll
And
include those
I'll
in.
send those to you tomorrow,
Oh,
Brittany.
perfect. Perfect, perfect. All right. Well, if there are no additional questions at this time, we will end this evening's presentation. Thank you so much to everyone who
Yeah.
joined us.
Okay. And I do have a real quick answer about Washtenaw County.
Oh,
It looks like there is a cancer support community of Greater Ann Arbor. If you just Google Ann Arbor Cancer Support, um, and then it looks like Trinity also has some um, cancer support programs over that way too.
perfect. Thank you so much for taking the time to find that.
Yeah.
All right, well, wonderful. Thank you
All right.
again so much. And thank you again to everybody who joined us.
Yeah. All right. Let me know if you do have any questions.
I will pass those on to you if we receive any. Thank you
All
again.
right. Yeah, you're
Bye.
welcome. You guys have a good night.